Hello. Welcome to the advocacy segment of Relay USA 2023. I am Donna Kimberly.
And I am Heidi Varner. We are your advocacy co-leads for Relay USA.
Earlier this year, the American Cancer Society debuted a new brand as well as a new vision statement to end cancer as we know it for everyone.
The organization also replaced its mission statement. The new mission proposes to improve the lives of people with cancer, their families through advocacy, research, patient support, and ensuring everyone has the opportunity to prevent, find, treat, and survive cancer.
American Cancer Society Chief Marketing Officer Kim Martinez stated in an interview with the nonprofit Times, "Cancer does not discriminate on the basis of age, race, or gender. There are some groups that are at higher risk with different outcomes. That is why we added for everyone." The theme of greater inclusivity is also reflected in the organization's new tagline, "Every Cancer, Every Life." Together, these efforts represent an acknowledgement that the demographics surrounding cancer are changing. ACS CAN, the American Cancer Society Cancer Action Network, has also updated their mission statement to advocate for evidence-based public policies to reduce the cancer burden for everyone.
ACS CAN, the advocacy affiliate of the American Cancer Society, is committed to ensuring everyone has a fair and just opportunity to prevent, find, treat, and survive cancer. We know that cancer impacts everyone, but it doesn't impact everyone equally. That is why diversity, equity, and inclusion are vital to ending cancer as we know it for everyone. ACS CAN is centering the lived experiences and voices of our diverse volunteer leaders through our affinity groups that influence, strengthen, and diversify communications, messaging, partnerships, policy initiatives, and volunteer recruitment, training, and engagement within their communities.
I reached out to Leslie Ferreira, ACS CAN Director of Grassroots Alliance's Health Equity, and asked her to share some information about these affinity groups, why there's a need for them, and what their goals are to combat these disparities. Leslie worked along with volunteers from some of these groups to compile a video that addressed my questions.
The American Cancer Society Cancer Action Network is committed to ensuring everyone has a fair and just opportunity to prevent, find, treat, and survive cancer. We know that cancer impacts everyone, but it doesn't impact everyone equally. And that is why diversity, equity, and inclusion are vital to ending cancer as we know it for everyone. ACS CAN is centering the lived experiences and voices of our diverse volunteer leaders through our affinity groups that influence, strengthen, and diversify communications, messaging, partnerships, policy initiatives, and volunteer recruitment, training, and engagement within their communities. ACS CAN is currently supporting and amplifying the work of the Black Volunteer Caucus, LGBTQ+ and Allies Engagement Group, ACC Se Puede Hispanic Latino Advocacy Alliance, and the Asian American and Pacific Islander Volunteer Advisory Group. ACS CAN is exploring establishing additional affinity groups to better reflect and represent the demographics of the country, recognizing that representation is a step towards justice, not justice fully realized. Up next, a member of the Black Volunteer Caucus to tell you more about their important work.
Hello, my name is Hyacinth Burrows, and I've been a volunteer with the American Cancer Society Cancer Action Network for 2 years. I live in St. Petersburg, Florida, and I'm Vice SLA with our state team. I became involved after my older brother was diagnosed with glioblastoma brain cancer at age 34. He means the world to me, and it was pretty eye-opening for me to watch him go through that. I'm also a public health professional, and I really want to make a positive impact on health inequities and cancer outcomes, which led me to becoming involved in ACS CAN. I'm also a member of ACS CAN's Black Volunteer Caucus, the BVC. Since 2021, the BVC has been advancing the inclusion and involvement of the Black community in ACS CAN's initiatives and campaigns. We guide ACS CAN's work to enhance, strengthen, and diversify communications, messaging, partnerships, as well as volunteer recruitment, training, and engagement within the Black community. BVC members are actively engaged in our local and state advocacy efforts through contacting and meeting with elected officials on cancer disparities, enhancing and building relationships with diverse groups and organizations, hosting national virtual education and awareness events, serving as spokespeople and facilitators for media interviews and trainings, and recruiting volunteers who can give a voice to the unequal burden of cancer in Black families. You may have seen or participated in our fireside chats that include experts and survivors that share their experiences with and policy solutions for specific cancer burdens in the Black community. Black people have the highest death rate and shortest survival of any racial or ethnic group for most cancers. Black men have a 7% higher overall cancer incidence rate, but a 14% higher death rate compared to white men. Prostate cancer incident rate in Black men are 70% higher than white men, and death rates are double those of every other racial and ethnic group. Despite lower incident rates in Black women compared with white women for breast cancer, the death rate for Black women is 40% higher. ACS CAN is working on policy change that will reduce cancer disparities, such as expanding Medicaid, pursuing passage of the Diverse Trials Act to ensure clinical trials reduce barriers to enrollment for diverse patient populations, and supporting the PSA Screening for Him Act to remove prostate cancer screening barriers for high-risk groups, including Black men. The BVC includes ACS CAN volunteers throughout the country so we can reduce cancer disparities and advance health equity through education, awareness, and policy change. Being an ACS CAN volunteer has been a dynamic and healing experience for me. What started out as a way to get involved and support a cause that has affected my family has evolved into so much more than that. There is a healing power in community, and I believe that together we have the power to maximize the impact of research through legislative implementation. This translates to improved health outcomes, better access to care, and new treatments for cancer. It's a way for me to be a part of the change I want to see within public health. For more information about ACS CAN's Black Volunteer Caucus, or to get involved, visit our website at fightcancer.org/BVC. Thank you.
Now let's learn more about the LGBTQ+ and Allies Engagement Group.
Hello, my name is Michael Myers, and I have been a volunteer with the American Cancer Society Cancer Action Network for 11 years. I live in King of Prussia, Pennsylvania, and I am a member of the National Ambassador Team and the Legislative Ambassador for our state team. Cancer has impacted my life since I was a child, with my aunt getting diagnosed with breast cancer and losing her battle, to then my sister and sister-in-law developing thyroid cancer and winning their battle, to most recently my mother being diagnosed with leukemia, as well as many friends and family and loved ones. I am a member of ACS CAN's LGBTQ+ and Ally Engagement Group. Since early 2022, the engagement group has been providing a learning, strategy, and idea exchange for volunteers and staff throughout the country that are working to increase awareness and advance policies that address the unique challenges and cancer disparities LGBTQ+ communities face. Lesbian, gay, bisexual, transgender, queer, and questioning, or LGBTQ people face a disproportionate burden of cancer, with both a higher incidence rate of cancer and later stage diagnoses. Gay and bisexual men have a higher risk of anal cancer, especially those who are HIV positive. This risk is higher for Black, gay, and bisexual men. Lesbian and bisexual women have an increased risk for breast, cervical, and ovarian cancers compared to their heterosexual women. Transgender and gender non-conforming people are less likely to be offered screenings that are appropriate to their organs and life-saving. Social stresses living in a society that can be homophobic and transphobic contribute to a higher smoking rates for LGBTQ+ people. Nearly 1 in 5 LGBTQ+ adults smoke cigarettes, compared to 1 in 7 heterosexual adults. More LGBTQ plus people that smoke prefer menthol cigarettes compared to heterosexuals that smoke. LGBTQ plus people are more likely to be underinsured or uninsured, be unhoused, experience poverty and food insecurity. These inequities can make access to health care, including cancer care, an even greater challenge. This is why ACS CAN's policy work such as expanding Medicare, advocating for continued anti-discrimination protections in the Affordable Care Act, and restricting the sale of menthol cigarettes helps address cancer disparities in the LGBTQ plus communities. The LGBTQ plus and Allies Engagement Group advises ACS CAN on initiatives that impact LGBTQ plus communities through supporting volunteer outreach and engagement strategies, increasing awareness, and providing information and resources for specific community volunteers and partners. Engagement group members are shaping social media messaging, communicating with elected officials and decision makers about LGBTQ plus cancer disparities, building relationships with groups and organizations that serve LGBTQ plus communities, serving as spokespeople and facilitators for media interviews and trainings, and recruiting volunteers who can give a voice to unequal burden of cancer in the LGBTQ communities. We are offering direction as ACS CAN navigates how to become better allies in our LGBTQ plus communities, given the current legislative landscape, and providing guidance on policies that address cancer-related disparities in LGBTQ plus communities by advocating for access to safe, equity, comprehensive, and inclusive healthcare without fear of discrimination. This work is important to me because it is life-saving, and the opportunity to live a healthy life should not depend on race, religion, sex, gender identity, sexual preference, or political affiliation. We need to make the healthcare system more welcoming, safe, and educated on the LGBTQ community, encouraging early detection and screenings. For more information about ACS CAN's LGBTQ plus and Allies Engagement Group, or to get involved, visit our webpage at fightcancer.org/LGBTQ group. Thank you.
Cancer is the leading cause of death among Hispanic Latino people, accounting for 20% of deaths. Hispanic Latino people have a higher risk for cancers caused by infections, such as liver, stomach, and cervix. In fact, Hispanic and Latina women have the highest incidence of cervical cancer compared to other races and ethnicities, and 32% higher than white women. Hispanic Latino people experience greater barriers to cancer prevention, screening, treatment, and survival due to discrimination, low-paying jobs, low-quality education and housing, language and cultural barriers, and limited access to health care and insurance coverage. Hispanic Latino people facing cancer and survivors experience high costs and are more likely than white counterparts to be uninsured and experience serious financial hardship. ACC Se Puede, Hispanic Latino Advocacy Alliance, was formed in 2022 and is working to reduce cancer disparities in Hispanic Latino communities and guides ACS CAN's initiatives and campaigns through increasing awareness, strengthening partnerships, influencing public policy priorities, diversifying messaging and materials, and recruiting and engaging volunteers that reflect the unique heritages, cultural backgrounds, and lived experiences of our diverse communities. To find out more about ACS CAN's ACC Se Puede, please visit fightcancer.org/ACC Se Puede or juntoscontraelcancer.org/ACSC Se Puede. Now let's hear from Miguel Melendez, ACT lead from New York, to tell us more about why the ACC Se Puede, Hispanic Latino Advocacy Alliance, is so important to him.
I just wanted to thank everybody, in terms of what's happening here. It's basically lighting a fire in me. I've been, starting to speak to my local elected officials and to contact people. I found a foundation, Betty Contra Cancer, and I've been learning a lot. there's a lot of, running around that has to be done and trying to make arrangements. But, coming here each month, it has lit a fire in me. So thank you.
Now let's talk about cancer disparities in the Asian American, Native Hawaiian, and Pacific Islander communities. Cancer is the leading cause of death in these communities, accounting for 27% of all deaths. Lung cancer is the leading cause of cancer death among both AA and HPI men and women. Breast cancer is the most diagnosed cancer and second leading cause of cancer death among AA and PHI women. AA and HPI people have among the highest liver and stomach cancer incident rates, 2 times higher than white people. Asian Americans, Pacific Islanders, and Native Hawaiians have lower screening rates for certain cancers like cervical and colorectal cancer compared to white people. And smoking cessation counseling is far less used in these communities because of language and cultural barriers. The way some Asian Americans think about cancer can be linked to cultural beliefs that may keep people from seeking screening or care. The word cancer itself carries stigma in some Asian cultures and can be tied to misfortune. Let's hear from a member of the Asian American and Pacific Islander Volunteer Advisory Group.
My name is Kira. I'm currently an ACS CAN volunteer, but I'm also leading the California Emerging Leaders Council right now, which is a group of youth and young professionals across California. I'm currently in Los Angeles, but I'm originally from the Bay Area. My why is definitely the youth. I got involved specifically first for my family has a history of cancer. My mom, my grandma, many people in my family have struggled with it, and that's originally why I started, and also why I continue. But one of the main driving factors right now is definitely in seeing the cancer community come together. With my time as a volunteer with the American Cancer Society, I wanted to continue in an advocacy role and bring together youth to talk about it and to really take action. And so that's really been my why for the past few years or so, and especially now. And specifically for me, how my culture impacted my loved ones' cancer journey. It's definitely, I grew up in a predominantly Asian area in the Bay Area. So our culture, it was a mixed bag. There was a lot of fellow other Chinese people, but there wasn't also a lot of Japanese Americans too, because I'm Chinese and Japanese. And so with my Chinese side, at least, it was definitely a stigma. Cancer was a stigma. If you had it, it was kind of bad luck, and it was hard to talk about with the rest of our family back home. But my mom was definitely someone who was always outspoken about her cancer journey and about being very open about where she is in her treatment and stuff. So that has definitely helped me. And then as for my Japanese side, Japanese Americans have a higher incidence of colon cancer. It is something that is in our family and is something that has impacted my dad, my grandma, and for me, my culture. It's really interesting to see how as a Japanese American, how our diet is impacted and stuff like that, just based on because we face colon cancer, we have to be healthier, we have to be more mindful, and it kind of ties back to oh yeah, the basics of eating broccoli and stuff like that. It's just a very interesting thing that's been passed down to me. And so yeah, that's my journey.
The Asian American and Pacific Islander Volunteer Advisory Group was formed in 2022 and is engaging and involving Asian American and Pacific Islander volunteers, organizations, and companies in ACS CAN initiatives and campaigns through partnerships, policies, education, awareness, recruitment, and collaboration with similar volunteer groups to advance representation and reduce disparities in their communities. For more information about the American Cancer Society Cancer Action Network, our affinity groups, and how you can get involved, please visit fightcancer.org. Thank you.
ACS CAN is currently developing an affinity group for volunteers in the 18 to 35-year age bracket. This group recognizes that young people have an important voice that we need to amplify in the fight against cancer. This group is looking for personal and professional development, leadership experience, and ways to contribute to important causes. ACS CAN strives to be the place to provide these opportunities.
No one should be disadvantaged in their fight against cancer because of how much money they make, the color of their skin, their sexual orientation, gender identity, their disability status, or where they live. That is why we fight for health equity. These affinity groups are assuring everyone is represented and their unique challenges are identified and addressed.
Thank you for joining us for our advocacy presentation. Let's work together to end cancer as we know it for everyone.